We're talking today to Dr. Tariq Ahmed. Dr. Ahmed is a UK reconstructive and plastic surgeon. Hi, Dr. Ahmed, how are you?
Hi, great to talk to you.
Wonderful to talk to you today. We're going to have a discussion today about reconstructive surgery and specifically about breast reduction. So let's begin with, what is breast reduction surgery?
Well, in essence, it's surgery to reduce the heaviness of the bust, but without loss of profile. Often there's an element of ptosis or droop in the breast that's also corrected, or indeed that may be the major component, and then that would be called an uplift or mastopexy. But the two things are related.
What are the reasons that people should or would consider a breast reduction?
Well, often a breast reduction is considered to be cosmetic surgery, but I really think in most cases it's not, because these women have such a lot of problems and symptoms. You know, they have breast pain or back, shoulder, and neck pain from the weight of the bust. The bra straps can cut in and give ridges, and you get rashes in the summer. There may be difficulty or extra expense in purchasing supportive brassieres, and of course, they can often be very self-conscious. It's common for these women to say to me that they find that when they're talking to people, that the person is talking to their chest rather than to the person themselves, and that makes them feel very uncomfortable.
What should you know before deciding to go ahead with breast reduction surgery?
Well, making a good decision on going ahead with such surgery relies on a detailed, individualized consultation and plan to go ahead if appropriate. You should feel comfortable with the surgeon. Make sure that they seem to be honest and open. Do they do this procedure regularly? Try and define clear aims for the outcomes that you want to achieve. Obviously, you need to know about the risks and side effects, that you're happy with them before committing to surgery. You have to think about the ensuing scarring, nipple sensation, breastfeeding, the shape, and you discuss with the surgeon so that you have realistic aims, because realistic aims will give you a better outcome, and you'll feel much happier with the outcome of surgery.
Tell me briefly about the procedure and what one can expect to happen.
Well, there's a host of operations, but as I tell my patients, in simple terms, if you imagine the breast as a cake, then breast reduction, in that procedure, a variable slice of cake is removed, and that which is left is mobilized to reshape the breast into a more pleasing and lighter profile. Classically, the operation does leave you with scars around the nipple, straight down and all the way across under the fold of the breast. That's the so-called inverted T or anchor-shaped scars. Nowadays, I myself use a more modern technique that doesn't involve leaving the large transverse scar, but has a much more limited sort of vertical or lollipop scar only. And with the more modern techniques, the main focus is to reduce and reshape the breast gland, and then secondarily to redrape and tailor the skin to fit snugly over the new breast cone.
Does breast reduction surgery have possible risks and complications?
Well, of course, you know, all operations have risks, and these should be explained to you before you commit to surgery. But the main ones that are specific to breast reduction involve the extent of the scars, possible sensory changes in the healing of the skin of the breast or the nipple particularly, possible problems with breastfeeding, and problems with delayed healing.
What should I do or not do to avoid post-op complications and to help me recover properly from my surgery?
Well, I mean, you will be given some instructions post-operatively, and compliance with that is obviously very important. One of the key things is that you should allow yourself the time and space to heal, and you actually will heal more quickly. Although it's not a really major procedure, it's quite significant, and people are today obviously busy and stresses and deadlines, but if you have those after your surgery and there's a time constraint, then often you actually find that you delay healing even more and get back to where you want to be later than you would otherwise be. Another factor is, well, yeah, as a doctor, I'm not here to criticize anyone's personal lifestyle choices, but smoking should really be a no-no for the duration of the surgery, as much poorer outcomes are associated with smoking. A lot of your postoperative problems can be avoided with common sense. You don't go out and do kickboxing and karate the next day. You do hear on the internet people go out dancing and partying the next day. This is significant surgery. It's a medical procedure. Take it seriously, and you'll get to where you want to be safely and with an excellent outcome.
Thank you. Thank you so much for talking to me today.
Pleasure.